I can't emphasize enough the importance of calling 911. I know you hear that all the time. I know sometimes people feel like, gosh, do I really want to draw that attention to myself? Do I want an ambulance pulling up in my driveway? Can't I just drive myself? And my answer is, please do not do that if you're having chest pain. And that's for several very important reasons. Number one, if something happens on the way, okay, if I'm having chest pain and my wife's driving me and suddenly my heart stops and I have a cardiac arrest, what is she gonna do? Is she gonna pull over the side of the road? We've had patients try to do this, to start CPR. At that point, is she gonna call for an ambulance to meet her? Critical time is lost. And by the way, a heart attack doesn't always necessarily result in the heart stopping or a cardiac arrest, but the patients are at very high risk when they're in the throes of a heart attack of that happening. So that's number one. If something happens on the way in a private vehicle, that can potentially be a disaster. Number two is just the speed at which that patient will be diagnosed. So if you drive yourself to the emergency department, I think our emergency department does a great job identifying, getting those patients back out of the waiting room, but it's still a lot faster if we know with a pre-hospital 12 lead, which we've talked about, a pre-hospital EKG, if I know 20 or 30 minutes from my EMS colleagues that you're having a heart attack, you're not going to go anywhere near the waiting room, and you're going to go right back to our table. So again, very, very important for safety, for streamlining diagnosis and treatment. Very important to call 911.